Merci beaucoup. That'll be the end of the French portion of my talk. Je m'excuse. Very happy to be here, and thank you very much for the invitation and the kind introduction, Louise. So today I'm going to talk about my work in Toronto's Regent Park, which is a very infamous public housing project very close to downtown Toronto, and I'll introduce the background on Regent Park. I think this is a really good example of population health intervention research in the sense that the organization that manages Regent Park decided to initiate a very ambitious program where they demolish 2,100 units of housing on a 69-acre site and rebuild it into a mixed-income community. And so I have spent the last 13 years working on this. From the very first meeting I had was 13 years ago. This is not a good career strategy, though, I should warn you. Those of you who are early in your careers, it is not a good career strategy to hook on to something where you don't really control the intervention. But anyways, I'll say more about that later. So thank you again, and as I say, this is a great opportunity, and very much looking forward to your feedback. Let me start with the site, Regent Park. So Regent Park, when the revitalization began, was home to 2,083 households and around 7,500 people before the demolition began. So you're going to see in a moment that the site is 69 acres, and they have split it into 5 pieces of land, and each piece is done and then demolish, rebuild, and then they move on to the next one. Phase 1, which began in 2005, was growing from 418 to more than 800 households. So in addition to demolition of the old public housing, it's replacement with mixed income housing and intensification, so many more units. So eventually the area is going to grow to about 7,500 units from 2,100. It's one of Canada's oldest and largest public housing developments. It was built in the late 1940s and early 1950s based on what are known as garden city design principles, a sort of towers in the park approach where there are mid and high-rise buildings and lots of green space in between them. The demolition and redevelopment began in 2005 and is occurring in 5 phases. Now, what's interesting is these 3 points here come from the very first meeting I had with Toronto Community Housing Corporation, which is this corporation that is owned by the City of Toronto, and they manage all the public housing in Toronto. They're the second largest public housing provider in the world after Glasgow Housing Authority. And so what's really interesting is, and this is because we're going to touch on themes around evaluation, I'm going to describe the meeting. The meeting basically started with the CEO saying to me, "We think we're building healthy communities." I said, "Oh, well, that's very interesting." And he said, "We think that mixed income is going to be good for our tenants." And I said, "Oh, well, that's an interesting belief." And there's an equivocal evidence base on that, and it's a testable proposition. He said, "We think that the urban design that we're going to put in place is going to be good for our tenants." And I said, "Oh, that's an interesting belief." And an equivocal evidence base and a testable proposition. Now, the social development plan, he said something similar about that. That became very kind of nebulous and changed over time, and I'm not sure that it was ever all that unified. So the main things that we were able to look at were these components of the intervention. But the idea of this is that the intervention itself is many interventions. It's actually not just one intervention. And a big part of the work of understanding the impact is actually trying to understand what actually is the intervention. That's actually a huge part of the work from the perspective that I take on these. So Regent Park, the original Regent Park was actually a slum clearance project. So this is 1930s. And this was the area that was eventually demolished and then built as Regent Park in 1930. There was a very famous report by the Lieutenant Governor of Ontario, a man named a doctor. He was a doctor. His name was Herbert Bruce. He actually founded the Wellesley Hospital as well. And he wrote a report in the mid-1930s in his capacity as Lieutenant Governor, criticizing the poor conditions that especially children living in and the health impacts of the poor housing that they were living in. So Regent Park was built, and it was built in two phases. The south part was built first on the left and the north on the right. So this is a little bit older, and this looks like public housing, right? If you were if you were watching it on TV and you wanted to know what public housing looked like, you'd probably put pictures like this, right? So that's an important factor, actually, and that we're going to talk about a little bit later. But on the other hand, it doesn't look that bad either, right? It actually looks like pretty decent housing, and it was decent housing. So the community, as I said, was about 7,500 people. 100% of the residents were rent geared to income, which means they received a housing subsidy and they paid whatever their income was. They paid 30% of their income for the rent, and the rest was subsidized. About 65% of the population had been in Canada less than 10 years, so a large immigrant population. 3.6 children per household, which is very on average. 41% of the population under the age of 16, so a very young population. Small number of seniors. The average income this is 12 years ago, 12, 13 years ago, about $15,000 a year. Diverse, multiple languages. I can't remember the exact number. It's somewhere in around 25 to 28 languages that we've done interviews in this community. So there's about eight languages that are very common. So when we sent anything, any kind of mailing to people, it comes with a cover that says in 8 different languages. This is very important. If you can't read this, if you can't read English, please get someone to help you to read it. And then we also provided resources so that if there's an agency that can help people as well if they don't have someone in their own personal network. So as I said, there were 5 phases. So phase 1 was this area. So this, for those of you who've been to Toronto, or know it well, this is Parliament Street here, and then this is Dundas Street that cuts right through the middle of the community. Regent Park North, Regent Park South, which is a designation that will probably be less meaningful over time. One of the things that they did when they built the original Regent Park is all these streets all used to be there, but they actually were not there. They were eliminated. They eliminated all of the through streets, in part because it was a place where prostitution was taking place and they wanted to stop that. So the only street that went through was really this one, and then they had this network of paths that went through. And there was a lot of problems with that design. One was that it was very hard to order a pizza because you might have an address that said 415 Gerrard Street, but you couldn't actually drive up to the building. That was the smaller part of the problem. But it also made it more difficult for policing, right? For crime prevention and so forth. So one of the things that they've done is reintroduce the through streets and use environmental crime prevention by environmental design is part of the component of the design, if you like. So this is an artist rendering of phase 1, and it gives you, this is now built, and people have been living there for several years now, but it gives you an idea of the overall view of it. And what's really interesting, I think, is important, and a few things to point out here. One is that some of these are social housing buildings and some of these are condominium buildings. So there was no mix within the buildings. There were distinct buildings, social housing, condominiums. It's much more intense. It's intense. There's very high buildings, so there's a lot of people living here. In addition to that, there's street level retail, and commercial, which is actually very important. In the old community, there was no retail and no commercial. It was 100% residential. The design of these buildings, so these rental buildings, for example, are social housing, and then this over here is condominium. But notice the materials are the same, the architectural designs are very similar, so it's actually very difficult to tell which are the social housing buildings and which are the condominium buildings, which is quite important because remember we said the pictures before, they looked like social housing. Well, that's not what the things around the neighborhood looked like. So it's visual normalization is one of the approaches that they've taken. The other thing that's really interesting is this here. So this is all one big complex, this building and this building. That's the street in behind. But this green space here is actually a private park that's at 2 stories high. It's 20,000 square foot private park that's only accessible to the residents of these 2 buildings. This was the first building that was constructed. And at the time they started, they had no idea how sales were going to go. This is a very stigmatized community. It's a place where, gunshots were very common. murders took place and so forth. And they just had no idea whether people would actually buy these condominiums. So their risk mitigation strategy was to create this private green space. Now, it didn't take very long before actually the sales went very, very well. And the prices starting to go up. So they didn't need to have all these risk mitigation strategies. But anyways, that's basically it. The other thing is you'll see here there's Sobeys, and actually the next picture so very early on, well before, when construction was very early stages, Sobeys came in and said, we're going to be an anchor tenant in the new building, and it ended up being Freshco, which is their discount brand. And so there's a Freshco, so that was the first time that there'd been a supermarket in the community. Tim Hortons, of course, came in as an anchor tenant. It's Canada, what would you expect? And then the other is RBC came in as an anchor tenant as well, which was actually important because there hadn't really been a bank there before, and they developed some new products that would allow the residents to benefit from that. So in addition to that, so this is a little bit of details on, that was phase 1. Phase 2, similar kind of program with respect to the construction of the buildings, normalization of the built environment, et cetera. But phase 2 is where the really big new amenities came in. So rather than having a lot of green space spread between the buildings like they used to, they said we're going to actually have one large park called Regent Park, what else would you call it, that is going to be in the center of the community. And we're going to add some significant amenities as well, including an indoor pool. So this is an artist rendering, but it was opened in 2012. It's actually a very beautiful aquatic center that was put in place. And one of the interesting things to point out about this is that there was a pool in the old community. It was an outdoor pool, so it was only open in the summertime. And it was kind of buried in the middle of the community. You couldn't drive up to it and park at it, for example. And it looked like it was institutional, like it was for the residents. This pool is expected to have a much wider reach. So it's actually meant to draw people into this area from outside, whereas before, nobody would really go to the Regent Park pool unless you actually lived in Regent Park. So I think that's a big part, and I'm going to talk a little bit about some of the theoretical understandings of what the intervention is. So we've been studying this for several years now, thanks to some population health intervention grants from CIHR. Had a large grant from the MacArthur Foundation at one point, actually, that I really saved the project. And it was the only housing-related grant the MacArthur Foundation has ever given to a foreign institution. So our primary objective was to determine if adults who move from old Regent Park housing to the new housing show significant improvements in depression and anxious symptomatology, the common mental disorders, as well as general health status. And the secondary objective was basically, are there any changes in what we would know as the social determinants of health? So things like housing satisfaction, neighborhood satisfaction, et cetera, et cetera. You'll see more about that in a second. So we did this as a partnership between what was then the Center for Research on Intercity Health. It's now the Center for Urban Health Solutions, where I maintain an affiliation, but that was my full-time job at the time. And we had Toronto Community Housing, so the people who were doing this involved, a local neighborhood group from Regent Park, the Community Health Center, the Christian Resource Center, which is, they actually have a building that was built for them. They're really non-denominational. They just provide a lot of support to lower income people. Federal government was involved, and they gave us some seed money. The Ministry of Municipal Affairs and Housing, which is the provincial ministry, they gave us some seed money. And then we had 2 tenants. So we had an advisory committee that included people from all these organizations plus 2 tenants. We had a multidisciplinary research team. I'm a geographer by training. I dabble in social epidemiology, and mostly, although I like to say I'm undisciplined. So, and then we had funding from a number of organizations. Ultimately, we did a prospective cohort design with a comparison group. So why focus on mental health? Well, one of the big reasons, of course, is that it's the second leading cause of disability in affluent societies. And the common mental disorders are interesting. So we avoided a clinical kind of approach to mental health where there's a binary distinction between people who have a mental illness and people who don't, and thought of mental health more as a continuum. And the fact is that there's plenty of disability below the clinical threshold anyways, right? So people who don't meet the diagnostic criteria, nevertheless can experience quite a bit of disability. And so we thought that what we wanted to do was track changes in the frequency and number of symptoms that people experienced as a result of changes in their socioeconomic circumstances, especially their housing. So common mental disorders are associated with significant impairments. They're very common, and studies have shown that they account for a third of days lost to illness and a fifth of general practice consultations in the UK. So really very common, and was a big concern in the community because there was a high prevalence. So that was the feedback we got from the tenants and from the community health center. Is that, and the other thing from the perspective of trying to understand what is the impact of an intervention like this on residents, it was something that we thought might actually change in a relatively short period of time and would be less complicated by a large number of, would have a short latency period and would be less complicated by a large number of confounders. Now, in the spirit of never letting a good cohort study go to waste, we also asked about a bunch of other things. So I won't go into the details about that, but we've got a lot of data, and so some of those things have actually shown some change as well. So let me talk a little bit about who we talked to. So we did what was effectively a pilot study in phase 1 with 60 people, and it showed some promising results. And then phase 2, we were able to get people prior to the demolition of their buildings, while they were still living in the old buildings. They knew they were going to be moving, but they were still living in the old buildings. So we recruited 153 people. Oops, I'm sorry, that's mistaken. Ignore the temporary housing. We had a recruitment rate of about 34%, and we had some attrition of 21 people, and we ended up with 132 at a 1-year follow-up, and 59 people moved direct. So the interesting thing is, the way they had done phase 1 is they moved people out of Regent Park. Some of them went to other parts of Regent Park, the older buildings. They had left vacant units open for a few years, or a couple of years earlier. And so some people moved there. Some people moved to other Toronto community housing properties. And then the thing that made all this possible is everybody had a right of return. So you had a document that said you can come back to Regent Park if you're a tenant in good standing. So that's what made this whole natural experiment possible, is the right of return. We knew people would be exposed at time 1 and then exposed to the new conditions at time 2. Now, what was interesting in phase 2 and unexpected was that because they had built so many units as part of phase 1, 59 of our 132 went direct to brand new housing. So they went to direct to brand new units from the old units, and 73 moved to what are called relocation housing, which for some of them it was other parts of Regent Park, but it was old units, and some of it was nearby public housing buildings. And 21 ultimately were lost to attrition, and we've actually got funding for a third follow-up after residents moved to the new Regent Park. So I'll tell you more about that in a second. So, as I said, 153 while they were in the old buildings. Some people went to relocation units. We did a second interview with 73 of those people, and then 59 went to brand new units. Does that make sense? Got another graphic for more or less the same thing. Okay, so I'm going to talk about the results from phase 2. So we talked to people who were about a little more than half were between 20 and 44. 42% were between 45 and 65. 31% born in Canada. 32% spoke English at home. 54% had more than a high school education. So they'd completed high school and more. Now I see this, yes, Louise is giving me the Spockian eyebrow. And I agree, that is something, to me, that is actually a selection factor, because people who are better educated do surveys and participate in studies. 45% lived in a household making more than $20,000 a year. 47% were married or in some kind of relationship. About 61% were stable. And what you see in terms of the kinds of units, we had a mix of low-rise, high-rise, and townhouse, and then a much different distribution because of the intensification, right? So a greater emphasis on taller buildings. So this is a summary of, and we can talk about type 1 error if you like, but nevertheless, I think it's worth giving you a broad overview. So we looked, the kinds of things that changed were satisfaction with neighborhood, satisfaction with home, sense of community, pride in the home. We saw no change in people's experience of their neighborhoods, of their neighbors. What's interesting, we asked about a number of different access to a number of facilities, recreation facilities, et cetera, et cetera. Nothing changed. The only one thing changed, actually, banks. So prior to, at time one, people said, we have a need for banks, we don't have access to banks, and afterwards they said they had access to banks. Sure enough, a bank was put in place. So we felt like we were detecting signals that were there as a result. Felt they had others they could depend on, no change. Felt safe in the neighborhood. I'll talk more about this in a moment. Took steps to protect themselves from crime, no change. And someone was a victim of crime, was no change. A little bit of a mixed signal on that. Feeling stressed most days, no change. Anxiety, we saw some evidence of change, but nothing. When we used the entire scale, it didn't show anything significant. No change in depression, but we did see a change in psychological distress, an improvement. Felt bothered by physical or emotional issues, no change. No change in life satisfaction. Self-rated health, no change. Needed health care but didn't receive it, no change. Now these are a couple interesting findings. Diagnosed with high blood pressure and diagnosed with heart disease. We used the questions from the CCHS, which ask, has a doctor ever diagnosed you with heart disease? Has a doctor ever diagnosed you with hypertension or high blood pressure? And we did see a significant number of people who changed from no to yes. On the one hand, you could interpret this as there was an increase in hypertension and heart disease, or it could actually be a caregiving phenomenon where people actually sought care and they had it before, but it just hadn't been diagnosed. So one of the things that has been shown when people undergo these kinds of changes, when they have to move home, is that they actually may engage in more self-care. We're actually seeing it. We've got a sub-study of parents and kids in Regent Park, and we've seen some evidence of parents engaging in more protective behaviors for their children, and the children actually benefiting from that, which is really interesting. There is another study done in the UK that showed when people had a forced move related to in public housing that they quit smoking. A significant number actually quit smoking, which was interesting. So I think this might be more of a diagnosis effect than a true health effect. And then no change in whether people had a regular doctor. Okay, so just a little more detail on this. These are some characteristics of people's relationship and use of their home. Pride in home increased from 49 to 93%. Home and identity increased from 46 to 85. I find it hard to be at home sometimes, which is meant to capture that your home is supposed to be a refuge, and if you don't feel comfortable there, it's not working in that way, and that declined. So that's an improvement, and my home is a good place to live my life increased. In terms, we asked about a number of things: interior design, noise inside the building, outside the building, safety and security, insects, cleanliness, repairs and maintenance, air quality, and home as a whole. And we across the board, we saw really large increases in satisfaction and all of those things. So, which I think is a really important outcome, right? And to have this documented is actually incredibly important, and I'll explain more about that more about that in a minute. Again, improvements in my neighborhood's a good place for me to live. I feel at home in this neighborhood. It's important for me to live in this neighborhood. I expect to live in this neighborhood for a long time. People generally get along. And then we also asked about grocery store, and we saw a small improvement in that one. Now, what's interesting is we saw some big improvements in personal safety and people's perceptions of police protection. And I'll give you a little more detail about that. It's interesting because we designed the questionnaire, and then a long time afterwards, the data comes back. And when the data came back, I remember thinking, oh, I didn't realize we put so many questions about crime in this. I had forgotten. And I'm glad we did, because we found some really interesting things. So the people who these are all the people who went direct to brand new housing. 73% said they felt somewhat or very safe in their neighborhood when we first interviewed them, and that went up to 95%. I feel safe being at home alone after dark. went up from 67 to 83%. I feel safe from crime when I'm walking alone after dark, up from about 50% to almost 80%. I stay at home at night because I'm afraid to go out alone. That declined, so that's an improvement. I feel worried about being at home in the dark, in the evening, and I would use public transit alone after dark more if I felt safer from crime. So some really striking improvements and a number of things related to safety. Now, what's interesting is that people's self-reports of crime victimization didn't change at all. So the perceptions improved, but the realities stayed the same. So, except for property damage. Someone in my household deliberately had property damaged, that improved. Gang activity, drug activity, all improved. Police treatment of youth, people's perceptions improved, and discrimination has an impact on community safety, that also improved. So overall, and I'm going to talk a little bit about the implications of this for the last 10 minutes or so, after I give you this brief summary. Generally, people's perceptions and experiences of their homes, their satisfaction improved, neighborhood satisfaction improved, and safety improved quite significantly. Also, reduction in psychological distress. But no change in feelings about neighborhoods, access to social support, need for services, physical health. And other aspects of people's mental health, depression and anxiety, didn't change. And we saw some negative, potentially negative change in self-reported hypertension and heart disease. So overall, I treat this as a reasonably good news story in terms of the impact. What's interesting is I was on the radio about 2 years ago when we were presenting these as preliminary results, and they were saying to me, the interviewer was saying, shouldn't we have expected more impact on people's mental health? Why didn't we expect we didn't get more impact on people's mental health? And I said, I don't think that's true, actually. From the very beginning, my expectation was that we might show a small improvement in mental health, but there's so many other things that affect people's mental health apart from their housing that we didn't have any impact on, right? So, and in fact, people's lives didn't change all that much, right? They went from living in an old, beat-up box to a brand new, nice box. But they were still low income. They were still subsidized housing tenants. They still were, the marginalized populations for a variety of reasons and had been for their entire lives. And none of that is reversed. They just live in nicer housing. So in a way, these two outcomes become that much more important because it's basically a commitment to say people should be able to live in housing that they find satisfying and rewarding for them. They should be able to live in neighborhoods where they feel safe and that they feel is meaningful to them. And if it affects their health, that's an added bonus, essentially, right? If they get better health out of that. Ultimately, our results were very similar to what we saw in phase 1 in that small pilot that I described. And the factors that are directly affected by relocation and this revitalized housing showed positive, significant results. These things, health, as I said, is shaped by many other factors. Now, one of the other things is that, and this is a problem with this, doing an evaluation while the intervention's in process, is that some of the new amenities were already built while people were in the old units. We actually had, quote unquote, contamination of the intervention group. So what was interesting is when we were doing the baseline surveys, the interviewers kept coming back after doing the questionnaires, and they'd say, oh yeah, people were talking about how nice it is that there's the grocery store now and the bank. It wasn't the bank wasn't built there, but they were saying that it's nice that the grocery store and the Tim Hortons. And I hadn't thought of it as, oh no, contamination. The upside of that is that the results are more conservative. So if people experienced any benefits from receiving a part of the intervention prior to their move, then that would have kind of raised their levels up, and then any change that we saw, then we can have more confidence was real. So let's think about this in a bigger context. There's a lot of debate about whether social mix is something that we should be trying to achieve from a policy perspective. There's actually quite a lot of evidence to suggest that concentrated poverty is really bad for people's health, and it's an added risk over and above their own socioeconomic status. So there's a deprivation amplification that actually comes from living in a low-income neighborhood. Now, social mix is a bit of a problematic term because it's very easy to be persuaded by it because it sounds so virtuous. Well, who would be against social mix, right? Having people from different incomes and different walks of life living together, it all sounds so harmonious. So it doesn't really get questioned. Now, the research and policy literature suggests that social mix may have 5 different impacts, including social capital and social networks. So this is based on the work of William Julius Wilson, a famous urbanist in the US, who says that concentrated poverty, neighborhoods in concentrated poverty, are isolated from job-finding networks and other kinds of economic opportunities. It can provide more social control through norms of behavior and so forth if you have social mix. Culture and behavior role modeling. This one's actually kind of insulting, frankly. It's based on the idea that, well, if we have social mix and all these low-income people see people going off and going to jobs and that sort of thing, they're going to rub their chins and say, oh, look at all these people going to jobs. Maybe I'll go get one. I don't think it works like that. I think, however, there might be an adult-to-child role modeling phenomenon that does make some sense, because kids might get exposed to different life trajectories that they otherwise wouldn't be exposed to. Political economy at place has to do with the argument that, in fact, social mix might bring more resources to a neighborhood because you've got people who are better educated, more influential, and so forth, and they get the attention of politicians and service providers and so forth. And then attitudes and experiences of social mix. The interesting thing about this is when you ask people who live in socially mixed communities, what do you think of it? They're mostly indifferent. It's like, oh, well, yeah, that seems okay. And so the evidence is, in fact, very little of any of these things happen, right? There's little interaction of people across tenures or across socioeconomic strata that occurs. And some people have concluded, therefore, it doesn't work. And so I'll talk more about that in a second. Role modeling, as I said, might happen between kids and adults. And there are some negative consequences sometimes. Sometimes there's conflict, and there can be a loss of affordable services. So even though in a place like Regent Park, everybody who was a subsidized renter stayed a subsidized renter, so their rent didn't change, the rents of social service providers and not-for-profits, those would be based on commercial rents. Those can go up, and you might actually lose some services that are aimed at low-income people. So the interaction one is kind of interesting because many people have said, well, the claim is that if you co-locate higher income people and lower income people, they're going to form close familiar relationships, and then the low income people will get access to the social networks and the economic opportunities that the higher income people have. And it just doesn't happen. And the fact that that's the expectation, frankly, was surprising to me, because when I thought about it in Regent Park terms, I thought, okay, so is somebody who lives in a condominium in Regent Park really going to invite someone from the social housing building over for a barbecue? And if that doesn't happen, does it mean that this failed? And I thought, no, that can't be true, right? There's no way that can be construed a failure. So we actually did a side study, I'm not going to talk about it today, where I said, let's approach the question of social mix more inductively. So this is a deductive approach. It says we're setting a threshold, and if it's exceeded, we say it succeeded. If it's not, then we say it failed. Let's do it more inductively and actually try and observe where do people mix together and what are their attitudes and experiences of that. So we used something called time location sampling, and we sampled people who were users of the space near the Tim Hortons. There's an arts and cultural center, and then also at the pool, and we interviewed people in those spaces, and we got some really interesting results. Again, fairly similar to, well, it's not that big a deal, but it's nice to see. So ultimately, as I say, the evidence of social mix is equivocal. Does this matter? Is this the benchmark that these people should be having barbecues together? And if not, what should the benchmark be? So I think that's really important. What is the measure of success? What are the appropriate outcomes? Mark Joseph, who's at Case Western in Cleveland, runs the National Mixed Income Center on National Mixed Income Studies. So essentially, they're tracking a number of different mixed income redevelopments, and he's got this concept he calls good neighboring, right? That the benchmark we should be shooting for is that good neighboring takes place, which is an interesting concept. So let me talk a little bit about some of the other processes that we think are going on and concepts that we've used to try to understand these. One is actually the notion of destigmatization. So Michelle Lamont is a sociologist at Harvard, and she has this has done a lot of work on destigmatization practices, which are essentially everyday practices that people undergo to avoid situations of stigma, to cope with situations where they're put into stigmatizing situations. So essentially, it's personal destigmatization. We suggest that this intervention, that one of the latent goals was actually place destigmatization as well. And so on the one hand, there was this normalization of the built environment that I told you about earlier on, where the built environment is constructed in a way that the same building materials are used, the same architectural designs are used, so that you can't really distinguish the nice, the low-income housing from the upper-income housing. And so we think that that was actually quite successful. One of the other concepts that Michelle uses in her work on destigmatization is the porousness of boundaries. And so she means this strictly in a social way, that's one way that people destigmatize is if the boundaries between different social groups are more porous. We think that one of the things that happened is that the amenities like the Central Park, the Aquatic Center, and now actually there's a whole other recreational facility that's being built with Maple Leaf Sports and Entertainment that includes a cricket pitch and a whole other bunch of facilities. These are drawing people in from all other parts of the city. So the boundary around Regent Park is much more porous because people will move out and people are coming in, more importantly. And we think that actually that's another way that the neighborhood is becoming destigmatized, is through this porousness of boundaries. Okay, so what are the implications for research? One of them, and evaluating complex interventions, one of them is that you can't read the elements of a successful intervention from the coefficients of a regression model. So in other words, if you understand a phenomena with a regression model, it doesn't necessarily mean that you can say, well, let's rank these by the beta coefficients and just reverse the things that are the strongest impact, right? It's actually the relationships between these phenomena are far more complex. So there's no necessary symmetry between causation and remediation. So we can't just, and this is a Penny Haw phrase actually, we can't just ram the causal mechanism into reverse like we would the transmission on an automobile, right? Well, we were going this direction, so we put on the brakes and we put it in reverse and we go back in this direction. It doesn't work like that. So the remedy to a problem is not necessarily simply reverse the causal pathway that created it. And we need to be able to approach, so we need to think about the interventions themselves in that way. And that's the problem of the social mix logic. The social mix logic was, if we say that isolation of marginalized groups from these broader social networks is the problem, then the remedy is co-location. Well, not necessarily. So we need research approaches that allow us to detect unexpected outcomes as well. And again, cautious about establishing benchmarks about what works because it really closes off other lines of inquiry. Much of this literature had basically dismissed socially mixed redevelopment and said, well, it doesn't work. No point in pursuing it. So I'll skip that one. That's repetitive, and welcome your questions and thoughts.